Hello, my name is Lucine Frangian. I am a nurse practitioner and I'm here to perform a infant head-to-toe exam. Here we have Leo. He is a 7-day-old male patient here for his first wellness exam since he got discharged from the hospital, and he's brought in by his mom. His date of birth is 8/28/23. Mom has no complaints at this time. She denies any abdominal distension, abdominal pain, bleeding around the umbilical cord, diarrhea, vomiting, fever, abnormal color changes, abnormal tone or high-pitched cry. So far, everything is checking out and he's eating well. Mother, on the other hand, as far as the maternal history, she's a 29-year-old female. 29-year-old female. This is her first pregnancy, so G1P1A0. This was a planned pregnancy. She has had prenatal care, has been routinely followed up by doctor throughout the whole pregnancy. She had a vaginal delivery and had labor about 22 hours. Complication-wise, she had polyhydramnios, uterine fibroids, ovarian cyst, and anemia. She gained about 39 to 40 pounds, denies any illicit drug use, alcohol abuse, smoking during pregnancy. And I think that's it. As far as Leo, he was born 8 pounds 4 ounces, 19 inches. He passed meconium in the hospital, has been having normal stools since. He's eating okay, latching about 15 minutes on each breast, no vomiting, just a little spit ups here and there. He's peeing okay as well. He has about like 5 to 6 wet diapers and 2 to 3 dirty diapers a day. He was born at 38 weeks, close to his due date. Let's see. He has no other history, no surgical history, no hospitalization since birth. No, it doesn't take any medications. He was immunized. He was vaccinated at birth, and then his mom got the Tdap at the 3rd trimester. And that's it, I believe. Okay, so we'll start with our examination. For the purpose of this video, we'll start with the systemic head-to-toe assessment. I understand in real life we might have to prioritize some over others, or start with breath sounds, heart sounds while the baby sleeps, just so it works better. But for the purpose of this video, we'll just do a head-to-toe. I want to look at the general appearance of the patient. Patient's currently sleeping. I don't see any apparent distress. Color is good for race. There's no nasal traction. The tone is good. So I'll start with the head. I'm looking to see he doesn't have any hematomas, any bulging, any abnormal textures on the head. I'm running my hand through the head. I do feel the frontal fontanelle, and I'm going to look for the posterior fontanelle. I don't feel any bulging or sunken areas. Hair distribution appears to be uniform. I'm going to measure the head circumference, starting with the above the eyebrows to the largest prominence of the occipital area. While I have the measuring tape, I will go ahead and measure his height from the head to the feet, and I will compare it to his birth height, which was 19 inches. I can also go ahead and measure the chest circumference at the nipple line. at the eyes, eyes are usually closed because they're sleeping. One way we can open the eyes is either hover our hand over the eyes or turn the lights off. They tend to open their eyes, and when they do, I'll go ahead and look for the red reflex, and I'll look for to make sure that the pupils are equal. I want to also make sure that the outer canthus is aligned with the top of the ear, and then in the ears, I want to make sure that there's no ear tags. They have the normal helix with the regular folds on each side. Looking at the nose, we want to make sure it has a normal contour, and we'll look for patency. We'll just obstruct one nair and look for any congestion in the other. We'll do the same for the other nair and see the patency for the opposite nair. The mouth, of course, I have gloves on. The mouth, I'm going to look for any the sucking reflex. I want to see how strong the sucking is. While I'm there, I'm going to look to see, I'm going to run my finger to the back of the mouth. I'm going to see if there's any cleft on the soft palate or the hard palate, and or the lip, if the lips are intact. And I also want to see that when they cry or when they have the mouth open, I want to see that the tongue is able to lift and touch the hard palate to make sure there's no tongue tie. And it appears to be normal. While I'm here, I can even check for the rooting reflex by touching the cheek or the corner of the mouth to make sure that he's chasing my finger in an attempt to find food, or the nipple or the bottle. That's that. I'm gonna run my fingers. I'm gonna look on the shoulders, right this area, to see if there's any webbing of the shoulders. I don't see any webbing. While I'm here, I will run my fingers along the clavicle to see if there's any crepitus, any step-offs from vaginal delivery. I don't feel any crepitus or step-offs. We've arrived to the chest now. I'm looking at the contour of the chest. It is flat, doesn't have any concave or bulging shape. Nipples are equal, symmetric. There's no nodules or abnormalities on the chest. Normal skin. I will then go ahead and auscultate with the bell. I'm going to do this for a whole minute. After listening to for a whole minute, I want to know if there's a regular rhythm and or if there's any murmur. I know there's no murmurs. And the heart rate, according to vital signs, were 143. Then I'm going to auscultate the breath sounds. I don't see any retractions. The skin color, there has no cyanosis, has a good pink color. So I'll go ahead and listen to the lung sounds. I can flip momentarily to the back. No wheezing, no crackles on the back either. Breath sounds are clear. And the respirations are about 40. At this time, we're going to move down to the abdomen. I noticed that the umbilical cord is still attached. The skin around it is not swollen, bleeding, or hard to touch. There's no nothing is oozing. It's drying up slowly. I don't see any umbilical hernias, any abnormal contour. At this time, I'm going to auscultate the abdomen, abdominal sounds. Normal breath sounds. Right now I'm going to go ahead and palpate gently. I don't feel the liver, I don't feel any masses in the abdomen. So now I'm going to remove the diaper. I'm going to palpate the femoral pulses. I'm looking for them to be equal. I do see that he's a male patient, so he's not circumcised. The urinary meatus is at the tip. The scrotum is not swollen. I'm able to palpate the two testicles. I don't see any discharge or abnormal things. While I'm here, I would like to check for hip flexion. I will have the legs at 90 degrees. I will gently bring them medial and kind of press down, just to feel like if I have any clunking or dislocation of the hip, and it appears to be good. While we're here, we can check for the extremities. We want to make sure that Leo has 5 fingers, 5 toes on each hand and foot, and appears that everything is intact. While we're here, we can check for the palmar reflex, just gently putting my finger in his palm, and he is able to flex his fingers over my finger. It's intact. And the plantar reflex is putting my finger on the bottom of his foot, and he flexes his toes over my finger. While we're here, we can also check for the Babinski. As I stroke my finger over the lateral side of the foot, he's able to flare his toes. Also, again, Capri-Fill is brisk. He's got good color. I don't see any overall skin. It looks without any abnormalities, lesions, or abnormal textures. I am going to gently twist Leo, stabilizing his head. I'm looking at his spine. I want to make sure that it's straight. I don't see any pustules, any abnormal skin rashes on the back. He's got that blue staining, kind of like a Mongolian spot on the sacral area, which is fine, but I don't see any hair patches, any dimples, any bulges in the bottom of his back sacral region. And in the anus, I don't see any tags or abnormalities and discharge coming from the anus. And the whole time, I see that he's got a good tone. I'm going to gently put him back. He's got a good tone regardless. And then lastly, we'll do the reflexes. We'll do the Moro. We'll have him in kind of like a semi-Fowler's. If I briskly put him down, he will have the Moro reflex, where his hands will make the C shape from being startled, and then they'll gently flex their arms and legs back. Then he's got the tonic neck reflex. If I briskly rotate his head on one side, the side that his head is flexed towards will be fencing position, where it will be extended, while the other side will be flexed. And on the stepping reflex, if I have Leo stand, he will attempt to step one at a time, lift one leg, then lift the other leg. This, I believe, concludes our assessment of Leo. As anticipatory guidance, I will tell mom to make sure that she puts Leo back to bed, his back to the bed, make sure that she doesn't put him on his belly, educate him on SIDS, prevent any placement of blankets or toys in the crib, prevent any choking hazards. Do not leave the child unattended while there's animals in the house like dogs or cats. Do not feed the child any cow's milk or honey in the first year of life, or just breast milk up to 4 to 6 months. Allow the child to latch on each breast every at least 15 minutes to 20 minutes. Have the child have a infant appropriate seat belt, 5-point harness, facing rear facing. No co-sleeping to prevent any kind of choking, suffocation. You can bathe Leo 2 to 3 times a week with mild soap. As far as the umbilical cord, to keep an eye for any infection such as swelling or redness around the umbilical cord, and to just make sure to keep the diaper below the umbilical cord to allow appropriate drying and prevent irritation. I will then ask the patient, ask the mother if she has any more questions or concerns, and address that before mom goes home with Leo. Thank you.